Senator Collins, who would have been here the whole time, but she was in an Intel committee. So, Senator Collins.
Thank you, Mr. Chairman. Mr. Kennedy, welcome, first of all. I agree with you that there needs to be more focus on chronic diseases like diabetes, like Alzheimer's. But it concerns me when I read a quote from you that says, I'm going to say to NIH scientists, God bless you all. Thank you for your public service. We're going to give infectious diseases a break for about 8 years. Don't we need to do both?
Yes, absolutely, Senator. The problem is there's been an imbalance. We've devoted all of these dollars to infectious disease and to drug development to make NIH an incubator for the pharmaceutical industry, and very little to chronic disease. But chronic disease is 92% of deaths in our country. It's 9 out of every $10 we spend on our budget. Why aren't we devoting at least equivalent studies to determining the etiology of our chronic disease? It just seems like common sense to me.
I would point out that in many cases it's Congress rather than HHS who sets the funding levels for various diseases.
But NIH decides, has panels that decide who gets funding, not Congress, Senator.
I want to share with you a discussion that I had with a Maine pediatric nurse practitioner. She raised the concern that if people are discouraged from getting their children vaccinated, we will lose the herd immunity in a classroom. And that means that a child who may be immunosuppressed and cannot get a vaccine are at risk of being in a classroom with an unvaccinated child, and thus at risk of getting the infectious disease because we've lost the herd immunity. What would be your response to that?
My response is that vaccine uptake for the COVID vaccine, for example, is down to 23%. And all vaccines are dropping, and they're doing that because people don't believe the government anymore. We need good science, and I'm going to bring that in. I'm going to restore trust, and that will restore vaccine uptake.
Well, you're certainly correct about what happened with the COVID vaccine, but let me switch to the polio vaccine. Do you think that the polio vaccine is safe and effective?
Yes, I do.
And so would you seek to reduce its availability in any way?
No, not at all.
The state of Maine has seen a steady and disturbing increase in Lyme disease cases over the past decade. We talked a little bit about this in my office. In 2023, Maine had a record number of Lyme disease cases, nearly 3,000 reported cases. Fortunately, there is a promising vaccine trial for Lyme disease that is underway at Maine Health in Portland. Access to a Lyme disease would be a monumental step forward in reducing the burden of this disease, which can have lifelong effects. I've seen it in members of my own family. As HHS Secretary have confirmed, what influence would you exercise over new vaccine approvals, such as one for Lyme disease?
Senator, you and I have talked about this issue. I've had Lyme disease. I lived in the epicenter of Lyme disease. Every member of my family my immediate family has had Lyme disease. I had a son whose face was paralyzed for a year. I have a son today who has been suffering with devastating effects from Lyme disease for 2 years. There's nobody who will fight harder to find a vaccine or a treatment for Lyme disease than me.
I very much appreciate that assurance, and I'm sorry that your own family has been so adversely affected. In Maine, we have a lot of people who work outside and work in the woods, and ticks are everywhere. So this is a very important issue to me. Thank you.
And to me too, Senator.